Welcome guys. So our topic is constipation today. Our intentions, looking at the pelvic floor muscle functions and the role that they play in bowel health. Looking at what healthy bowel function looks like as well as dysfunction. And then coming up with some tools and strategies to manage the bowel health. And then we can share, learn, and support. So I always like to start off a conversation with my pelvis. So getting oriented to the pubic bone and the tailbone, and then looking at the pelvic floor muscles and the space that they cover. So really being able to point out that, we're looking at the vaginal opening, the urethra, and we're looking at bowel function and bowel coordination, but this is the anus, so the pelvic floor muscles cover both areas. So, pointing out that sometimes people are coming for their bladder control, but we end up really kind of teasing out some bowel health as well, because there's a lot of overlap there. Or maybe some constipation could be leading to the bladder symptoms or any other symptoms that you may be having. So straining, having a paradoxical contraction, the opposite happening of what you're intending or what your mind-body connection feels it's doing. Looking at hypertonicity and dyssynergia. So just overall pelvic floor integrity and coordination. Looking at, not suppressing the urge. So our bladders are created to be able to store. It's like a storage unit. Our rectum is not a storage unit. It is made to be transient, and once it's there, it wants to be able to evacuate. If it does end up staying there, if we suppress the urge, or if it ends up spending more time there, the body, especially if it continues to back up into the colon, the body will continue to reabsorb water out of the stool, which will then make it more constipated and harder in consistency, and then making it more difficult to be able to pass. We want to look at nutrition and hydration, looking at the muscular and the connective tissue component of being able to eliminate, but also looking at the consistency of the stool. So, how it's being formed, what's going on with your digestive and GI tract. Motility. So looking, how fast or how slow your body is processing the food. If it's too fast, you may be having those loose stools because your body's not able to absorb the water and hydration. And if it's too slow, then again, you could be, getting that more constipated stool and pulling out too much water. Injury and pain. So when we get an injury, or if we're having pain, we could potentially be tensing up the muscles and the connective tissue in those areas, leading to difficulty to be able to lengthen for evacuation. Compression or high intensity fitness. So if you're looking at cycling, where you have a lot of direct compression to that perineal pelvic floor area, or the high intensity fitness, if you tend to use poor breathing strategies, holding your breath, tucking your pelvis, all these adding strain to the structures, and potentially causing dysfunction and musculoskeletal imbalances. Traveling, traveling makes people constipated is a pretty common occurrence. So, looking at your routine, and we'll break down the routine and be able to figure out tips. Bowel is like habit. So how can we kind of create a nice familiar routine that we can take when we go on the road, and start to trigger the brainstem and the bowels that way. Certainly looking at stress, anxiety, and trauma. So, right now it's, for those people who have like a real fear of public bathrooms, being at home, they may be experiencing less constipation. However, right now, being at home, the reason we're at home is a very stressful situation. So may not quite correlate and translate. So looking at, what your stress levels are and what your anxiety levels are, history of trauma, whether it's an injury or if it's like a sexual trauma or a birth trauma, considering all those factors. Looking at hormone levels, pregnancy, looking at the intra-abdominal pressure, hormone levels again, mobility. So if you're less mobile, you're not going to be able to have that good GI mobility, as well as the pressures. The GI tract are going to be stretched and repositioned. Looking at medications, if people are on opiates or pain medications, and then different diagnoses to be considering. IBS, SIBO, there's a lot of GI diagnosis. Autoimmune, neuromuscular disorders, traumatic brain injury, nerve damage, lumbar spine injuries, stroke, and cancer, to name a few. Pelvic floor and constipation. So the pelvic floor muscles, just looking at the 5 S's, the 5 functions of the pelvic floor muscles. So the sphincteric, so the open and close. So that's your direct correlation to maintaining continence, as well as opening and allowing for elimination. Support of the pelvic floor organs that are above the pelvic floor in this pelvic bowl. Stability, so the pelvic floor muscles connect to these bony landmarks, the pubic bone, tailbone, and sacrum, and then the sit bones. So they create stability and tension through these bony landmarks, which help stabilize the pelvis with our functional mobility. Sexual function, as well as the sump pump, to be able to kind of move the circulation and the lymph system through. Continence and elimination, and then shortening and lengthening. So, we need to be able to lengthen to eliminate. So making sure that when we're having a bowel movement, that we're not forcefully bearing down, one, because it's a lot of added pressure and strain on the organs from above. So we could be potentially putting ourselves at risk for pelvic organ prolapse. But then also, if you're straining out bowel movement, if you're holding your breath and you're tensing your abdominal muscles, you are most likely tensing your pelvic floor muscles as well. So now you're trying to push something through something that's restricted and tight. So, connecting with the pelvic floor muscles to be able to open and lengthen, and then to add a little gentle pressure if needed. And we'll go over some strategies for that. So some voiding techniques. So the pelvic floor muscle lengthening. So that inhale, using your inhale, so the diaphragm and the pelvic floor, on that inhale, they are both lengthening down, and the abdominal wall is expanding open. So if we've got our diaphragm under the ribs, the pelvic floor at the bottom of the pelvis, as we inhale and those are lengthening, the abdominal wall is expanding out as well. So it's that balloon effect. So we're getting expansion around the sides, up at the top, the chest is rising, the ribs are expanding, and the pelvic floor is the bottom of the balloon, and that's lengthening and opening. And that's the action that we want when we're trying to have a bowel movement. We want to lengthen and open, so we're expanding. Then we also, if you need to add some pressure, once you're lengthened and opened, now you can add that pressure with what I like to call straw hand. So if you make a fist and you blow through the straw hand, I want you to feel what happens to your pelvic floor. Does it close and lift, or does it seem to open and expand and lengthen down? So first is the inhale and the balloon filling and the expansion and lengthening. And then you're going to stay expanded and lengthened. And you're going to add that gentle pressure. And you should feel a nice opening. There's different noises that you can use as well, but I usually go straight to the straw hand, because especially if you're using a public restroom, it's much much more